Mental illness is on the rise in America. Nearly 1 in 5 adults, that's more than 50 million people, are impacted by some form of mental illness. For these millions of people, getting care can often be extremely difficult. While more than 160 new medicines are in research and development to treat mental illnesses, there are still barriers that stand between people and the treatment they need. Barriers like stigma toward mental illness, underrepresentation of minority healthcare providers, and inadequate health insurance coverage, with narrowing networks and limits on what prescriptions are covered. Data shows that 56% of people with mental health conditions who need medication are worried they won't be able to get their prescription when they need it. And for patients battling these conditions daily, unexpected out-of-pocket costs or having to wait for prior authorization from their insurer can be detrimental to their health. Researchers are working to identify biomarkers, which are measures or physical signs used to evaluate how the body is functioning. Identifying these biomarkers helps improve diagnoses, measure disease progression, and gauge a patient's response to a given medicine. These biomarkers can also be used to find new treatments by helping doctors understand the mechanisms that contribute to a mental illness. Millions of Americans need access to medicines to treat their mental health conditions. And this problem is only growing. 94% of insured Americans managing a mental health condition want more predictability and certainty with their out-of-pocket costs. As policymakers consider reforms to strengthen our healthcare system, it's important they tackle systemic insurance hurdles that deter people from being able to get the care they need. That's why the biopharmaceutical industry is committed to advocating for those who battle mental illness, and will continue to research and develop new medicines to help those in need.